Well, good morning, everyone. And once again, welcome to another live this morning. Nice to have you on with us. We appreciate it. And let's see if we can get anyone to say hello here. Just turn this on. Okay. So how are you? And welcome, everyone. And let's see, who's number one on the hit parade this morning is, let's see if my scroll, there it is, Barashan from Montreal, number one, and Rosa from Montreal. How do you like that? Number two. Nativity. Good morning, Andrea. Maureen from Boca Raton, Florida. Good morning. John, our dear friend from Elgin, Illinois. How are you, John? Judy, New Brunswick. Lorraine, British Columbia. Linda, New Brunswick. Dennis from Norwich, Ontario. Georgie, Halifax, Nova Scotia. Maria is on with us this morning from Portugal. Love it. Diane, Lily, good morning. Wendy from Aylmer. Bonnie, how are you? In Little Britain. Carol, Moncton, New Brunswick. Janice from Brampton. Rain clouds on this morning from Michigan. Hi, Sue from Bolton. Patricia from Windsor. Lee's on with us this morning, and we appreciate it. John from Sheridan, Wyoming. Oh, sounds beautiful. Lori, Cambridge. Marlo, Ottawa. Anna. Gary from Bolton. Cheryl, Mississauga. Donna, how are you? And Ornella. Diane. No, Leanna. Sorry, Leanna. Elsie from Newfoundland. Bray. You're way down there. What happened? Grace, Newfoundland. Lucille, Lorianne, and Anna, Smoky in Manitoba. Yeah, well, all the smoke is cleared here. Eileen, how are you? Brenda, Francis from Vaughan, Kristen, Saskatchewan. Thanks for coming on, guys. Hi, Judy. How are you? Kristen is having her coffee. Me too. Hi, Chaz. Danny Lay. Heather in Miramichi. Sue, how is you? On Manitoulin Island, God's country. Linda in Sturgeon Falls, and Rosalinda is late this morning from Niagara Falls. John, how are you? Linda, oh, we love those Lindas. Nick, how are you, Nicole? Denise, Oakville. Nellie. Oh, no, Brahim is saying his notifications. Hi, Cheryl, how are you? Tom from Buffalo. How is you? Thanks for coming on, Tom. Fran, how are you? Okay. Janice said she was number two. Kevin, there he is from Pugwash, Nova Scotia. Kevin, our mayor, is traveling. Yvonne, another Nicole from Magog, Quebec. Douglas, how are you? Cheryl, Marilyn, guys, we love you dearly. Okay, now, Joanne's got a question for us. Let's get going on our Q&A. Thanks for coming on. Hi, Tina and Sharon and Sue. You guys are wonderful. My son suffered major surgery due to diverticulitis when he was 20, now 38. They told him to up his fiber by taking Metamucil every meal. Well, look, Joanne, I know what you're asking, okay? I know what you're asking. There's two schools of thought. And there often is, okay? There often is. The main school of diverticulosis, okay? Diverticulitis is an infection that can occur when you have diverticulosis. Diverticulosis is you develop little pouches in the colon. Okay? Now, medicine in general, on the broad road, where most of them are, they believe that you need fiber. And me, okay, the way I look at it, Joanne, what caused the diverticulosis in the first place? Fiber. Too much. And look, sometimes there's some genetics involved, there's weakness involved. We all have our different weaknesses. Some people have more susceptibility to diverticulosis. But my experience over the years, okay, clinically, was most people, when they had diverticulosis that turned into diverticulitis, they had too much roughage in their diet. I used to simplify their diet. And I understand in a way in doctor's training, well, you need more fiber because you don't want to be constipated and you want to be cleaning out and you don't want any feces to stay in the bowel and that gets into those little pouches and gets infected. I understand that, but I found, okay, my clinical experience is I used to get them off the fiber. I used to get them on eggs, meat, and cheese. Lots of water. The best fiber in the world is water and coffee. I found when I did that, the clinical results were astounding. Now, of course, they should be on probiotics. They should be on bone broth. They should be on digestive enzymes to break all the food down. But the way I treated diverticulosis and people that had diverticulitis that I didn't want it to come back, I went after the healing and healing those pouches and laying off the high fiber diets. Okay, that's the way I operated. And do I believe I'm right? Yep. Do I respect the other side? Yes, I do. I can't tell your son not to take Metamucil. Okay? I won't do that. But he better be doing the things that I talked about in terms of digestive enzymes, probiotics, bone broth. L-glutamine is in bone broth, collagen. It rebuilds the bowel, and even mucilages, like slippery elm and things like that really, really help. Okay? Thank you for the question. That was Joanne. 2 Joannes in a row. What's the difference between estrogen and xenoestrogens? Very good question. Okay? Estrogen, ladies, you have estrogen. When you get older, perimenopausal, menopausal, your estrogen goes down. And we always talk on this program about the balance between, for ladies, between your estrogen and your progesterone. Okay? They need to be balanced. The question that Joanne is asking, what are xenoestrogens? Well, xenoestrogens are things in our environment, like microplastics, all the chemicals that are in our kitchen, our cleaning products, air fresheners, all these things are xenoestrogens, meaning that they mimic estrogen. They look like your body thinks they're estrogen. This is why, guys, you have to understand where I come from. In the world in which you and I live, There's way too much xenoestrogens. They mimic estrogen. Your body thinks it's estrogen. And they elevate the amount of estrogen in your body. So this is why, or one of the reasons, I don't like estrogen therapy. I know people, gynecologists and doctors, they like estrogen therapy. I don't. I like bioidenticals, but I'm much bigger on progesterone, because what doctors don't realize, most of them, is it's progesterone that sinks like the Titanic, and it's progesterone that balances out those estrogens. Now, let me go a little bit deeper. Cancers, breast cancer, ovarian cancer, uterine cancer in women, prostate cancer in men. Too much estrogen. There's too much. And these xenoestrogens play a big part in that. And this is why I talk about blocking estrogen. It's why I talk about not taking estrogen in terms of a bioidentical or estrogen therapy that doctors give in birth control pills, for example. Or when women get into menopause, they want you to take an estrogen medication. I don't like it. I don't like it. Now remember, in my clinical days, let me see if I can find something. Don't mind me for a second, okay? I used to do, okay, so if you're on with me live now, otherwise you wouldn't be able to see it. You got to be live, okay? I am showing scans, okay? And I used to do this in my office because we could look for estrogen. And the dark here, okay, you can see it. That's estrogen on the belly here, okay? And this is a patient that I actually use, DIM. I have it here. Hold on a minute. Let me see if I can. Don't mind me, guys, for a minute. Give me a minute, okay? And I hope I don't break anything. I'm going to show you something. I want to show you estrogen dominance here, okay? Don't mind me, okay? I'm back. I want to show you dangerous estrogen on a scan, okay? This is dangerous estrogen, guys, okay? And see the black, okay? And you would see it on the inflammation here. In around the breast tissue, okay? This was very specific thermography for estrogen, okay? They should do it. They don't do it. I was trained to do this, to take, okay? And thermography, they look for inflammation, but I used to like to do another one where they look for estrogen. And like in this lady here, okay, I said, this is very dangerous. You got too much estrogen. You don't want to give a patient like this estrogen. Oh, doctor, but I'm in menopause. I got menopausal or perimenopausal symptoms and I'm dry. And we're going to talk about this even with frozen shoulder, okay? Women in menopause can get a frozen shoulder. Everything is drying up. But I don't like giving estrogen because of what I'm showing you here. Okay, here's another one, okay? I saved some of these from my clinic days. Look at this lady here. Look at all the estrogen on her body. Can you see it? All those looks like leper spots. Okay? And then I want to show you before and after, because I'm going to show you what I did with these patients. Once I gave them DIM, I dimmed it out. So, okay, now here's the lady with all the estrogen. I'm going to show you before and after. Okay, look at all the estrogen. You see that? Now, for the folks who are listening, okay, can't see this. You're listening on the podcast here. I'm showing a woman with a lot of spots. And those are estrogen spots, okay? And right around her chest wall, breast tissue. And this is her about 6 months later. Okay? Before, look at all the estrogen. After, where's the estrogen? Where is all the estrogen gone? Well, we dimmed it out. I had her on flax seeds. I had her on our menopausal formula with DIM. Estrogen, ladies, I know it makes you a woman. I'm well aware of that. And a lot of people, and you're going to, people on Dr. Martin, my doctor wants to give me estrogen. Look, that's up to you. I'm not your physician. I'm giving educational purposes only here. We're talking about what I used to do in my office. And I never gave estrogen. I might have given bioidentical progesterone. We're trying to elevate progesterone to balance out the estrogen. So when people are surrounded by we live in a world full of estrogen. That's why men, we get so much prostate cancer. Why we're not winning the war on breast cancer. We're not winning the war on ovarian cancer. We're not winning the war on uterine cancers because estrogen is involved. It's a growth hormone. Estrogen, when it's balanced, is beautiful. It makes you a woman. Beautiful. No one's talking about getting rid of estrogen. What we're talking about is balancing estrogen. That's what I do, okay? I used to prove it to patients, okay? I used to prove it to them with before and after results on a scan, okay? So, I found it to be very effective. Thanks for the question. Okay, let me see. Who was that? I know it was Joanne, I think, right? Yep. Okay, Jennifer, what would Dr. Martin think of getting a Botox shot into your bladder? Well, why do you have that? Why would you get it? Suggested because I have to go pee quite often, and I do not completely empty my bladder. You might have interstitial cystitis. You might have a descending bladder. I don't know. I don't know what to tell you about the Botox. Look, I mean, there's probably some side effect to it. Your urologist suggested it? Look, I don't have a lot of experience to talk about Botox in the bladder. I've heard of it, of course. What I used to do is try and elevate progesterone in women. Usually when I find with bladder issues, they had a recurring yeast, a fungus. And that combined with low levels of progesterone would descend the bladder and coat the bladder. So I used to get them off sugars, get them on broad spectrum probiotics. I would dim out the estrogen, elevate the progesterone, and I don't know about the Botox. Maybe others here can comment on it if they know people that have had Botox injection into the bladder. Like I said, I know about it, but I don't know how to counsel you too much. Okay, thank you for the question, Jennifer. Maxine's talking about burning mouth syndrome. She's been given gabapentin, which is a nerve pain medication. Just usually with burning mouth, I found, this is me, in my practice, when I saw it, usually they were low in B12. I had them on B12. I had them on Navitol, pine bark extract for opening up blood supply. I found that treatment to be sometimes very effective for burning mouth. Not always, but oftentimes was. When in doubt, okay, nerve pain, when in doubt, B12. It's the nerve vitamin, okay? So try that, Maxine, okay? Laurie, when you mentioned the war on supplements, okay, it got me thinking that there is a way to store supplements for long term. Well, I guess if you put them in the freezer, I don't think there's any concern, Lori, right in the short term that they're going to ban the supplements. Like they were talking about it. Maybe they'll do it. I hope they don't. I hope we don't become like Europe, where you need a prescription from a physician to get your supplements. Canada was moving towards there. We're trying to put a stop to that. We have been petitioning our members of parliament not to allow that to happen. And but if you had to store them, I guess you could put them in a freezer. They would be stored. It's a good question. Okay, that was Laurie. William. Dr. Martin has mentioned that excessive estrogen involved in prostate. Yep. Two things on the prostate. Estrogen, men have more estrogen than their wives at the age of 50 and up in general. Estrogen goes up, their testosterone in men goes down. 2, insulin. Estrogen and insulin are growth hormones. They make things grow, okay, including the prostate and breast cancer. Okay, so what PSA numbers does it see for normal range and trouble prostate? Well, listen, PSA, and I brought this to you. Let me bring you out the book, okay? Since you brought it up, William, I'm showing you the book, The Great Prostate Hoax. The inventor of the PSA test never wanted that test to be used to get a biopsy. Never. He called it the Great Prostate Hoax. Because he said he invented that test for inflammation of the prostate, not cancer of the prostate. Okay? And men, what makes your prostate inflamed? Estrogen, insulin. Block the extra estrogen with DIM. What numbers? Anything above 2 or 3 tells you that you may have some inflammation in the prostate. Not cancer, but inflammation. Big difference. Big difference between the two. And again, go back, William. I did a whole podcast on this. Okay? I should get the number for you. I'd have to go look for it. But it's pretty recent. the great prostate hoax, the PSA test. Okay? Yeah, and you can dim it out. And what numbers? I never took the PSA seriously for cancer. Okay? More for inflammation. Sue, what are Dr. Martin's opinion on using xylitol? Well, look, I mean, it's a sugar alcohol. Look, these artificial, look, this is more of a natural one, but still, xylitol in a small amount, I got no issue with it. I really don't. Okay, like if you want to be a purist, you're not using any of these sugar alcohols. But they're better than aspartame. Okay, there's some negativity around xylitol and uric acid. I've seen studies on that. But if you have to have a little bit of xylitol, not going to kill you. Okay, not going to kill you. Okay, Jackie. Does protein take longer to digest? Yes and no. Okay? You get this all the time. Okay? You get this all the time. Gurus out there, they're fiber enthusiasts. There's not a lot of programs that I don't go through this. People, they put the plant kingdom ahead of the animal kingdom. Okay? And plants are easier to digest than protein from eggs, meat, dairy. Okay? And yeah, it takes a little bit longer for protein to break down. But remember what I'm going to say here is very important. Your stomach was designed to eat protein. Your stomach was designed to eat eggs and meat, lots of it, and dairy, okay, like cheese and butter and cream, okay? Your stomach's designed for it. Your stomach is designed to break protein down. That's why the pH in your stomach is much different than the pH anywhere else in your body. Your pH of your stomach is so acidic that if you were to take your acidity and in your stomach, it should burn a hole through your kitchen table. It's made for protein. So to some extent, yes, protein takes a little bit longer to digest. But, and this is the big but, guys, this is very important. When you eat protein and your stomach, okay, let's follow steak for a minute. You have a piece of steak. It gets into your stomach. The acid in your stomach breaks it down, breaks the protein down and all the nutrients in there, and it bite-sizes it. So what? So that your body takes in all of the nutrition from the steak. Your heme iron, your B12, all your carnitine and your carnosine and your CoQ10 and all the things that steak is so famous for. Let me show you my t-shirt this morning. Sun, Steak, and Steel. Okay? So your body's designed for it. It's only when you live on sugar. It's only when you live on carbs. It's only when you live not on steak, but on and even fruits and vegetables. Okay? Am I against fruits and vegetables? Nope. But what is really harder to digest? I want you to think about this, because digestion is not just your stomach. It's what ends up in the large intestine. And when you eat steak, and this is why people, when they get on the reset, they go, Dr. Martin, I didn't go to the bathroom. I didn't go number 2 as frequently. I said, I know. Because you've digested all the food. And people get this idea because medicine, nutritionists, the food companies, fiber. You need to eat our cereal because it's fiber. And you're gonna be able to go to the bathroom. And you're gonna have a big poo. As if you win a prize. But think about it. What is harder to digest? You have a steak. Let's say you eat eggs, meat, and cheese. And you go, Doc, I didn't go to the bathroom every day. It's because you have no garbage to throw out. When you're on a lot of fiber, you got a lot of garbage to get rid of. Things that your body, fiber is mostly insoluble. It bulks up your stool. Well, so what? What does that give you? Okay? I'm not saying you should never go to the bathroom. I'm just saying, why do you want to go to the bathroom and have a big stool all the time? So what's harder to digest? Meat or fruits and vegetables? Or cereal? Or whatever. Because at the end of the day, they end up with a bigger stool and more in the toilet. Whereas steak is rapidly, all the nutrients are brought into the small intestine. There's very little that's getting into the large intestine on the way out into the toilet. So this is the way, see there, again, it comes to 2 schools of thought. You have the fiber school. And Dr. Martin, if I don't have oatmeal every day, I'm not going to be able to go to the bathroom. Okay? I'm not going to be able to go. I need to go. I need to take Metamucil too. And I got to have my, Okay. But when you have food that gives you so little residue, so little garbage that's left to go through the large intestine into the toilet, think about that for a minute. It's your nutrients go right into your small intestine and then into your blood for delivery. That's what you want out of food, isn't it? You want the nutrients. Now, I'm not saying you're not getting them from fruits and vegetables, but you're not getting as much. That's why I always tell people, you can have fruits and vegetables, but don't live on them. You're not meant to. Your body wasn't designed for that. You're not meant to be a vegetarian. You're not meant to be a vegan. I'm sorry, you're not. Your body wasn't designed for it. In spite of what they're telling you, there's 2 schools of thought. I know I'm on the narrow road, but I'm right. I'm right. Okay, guys. Let me see. Okay, let me just see how many more I have to do. Okay, so Jackie. Okay, why don't we do the rest on Monday? Okay, remember now I ended up with the PH. Okay, we'll do that. We'll do it on Monday. Guys, I know I'm very opinionated. Okay, I know I am. But you asked the questions, I'm going to answer them. Okay. You guys are wonderful. Thanks for coming on this morning. We appreciate you more than you know. Okay? More than you know. Love you guys and talk to you soon.